Hello everyone, I am Dr. Sushrut Pownikar. I am Head of Quality Assurance Department and also HOD for Laboratory Medicine at Oncquest Laboratories. Today we will be talking about maternal markers and its significance. Before we do that, a brief background onto the maternal markers. Aneuploidy is a condition where the number of chromosomes are probably less or more in an individual, which can cause congenital abnormalities in a patient, in this case a baby. When you are talking of aneuploidies, these are the congenital markers which you are supposed to be detecting early on during the pregnancy. To detect these anomalies earlier on, we used to take up conditions like the maternal age. If the maternal age is on the higher side, you would say that chances of the baby to have congenital abnormality is more. Then slowly and surely, historically speaking, we started adding on few hormones onto the mix. By and large, the definitive tests which are normally advised, which is amniocentesis and chorionic villus biopsies, are more or less invasive tests, and that is why it is frowned upon that during pregnancy you are carrying an invasive test which might harm the baby and in fact might lead to an abortion in some cases. What are maternal markers? These are basically markers inside our body which are fluctuating physical criteria. Let's say for the mother's age, or the LMP, that is the last menstrual period of the mother, or the expected gestational date of the mother, or in this case the mother's weight. So there are these variables due to which these markers fluctuate. Given these markers, like example beta HCG, free beta HCG, PAP-A, inhibin A, all these markers are the markers which actually are involved in pregnancy, and according to those values fluctuation, we try to look at this from a sophisticated software. Now this software, what does it do? It takes care of all these variables in a mother's physiology and its mother's biochemical makeup, and it also adds in certain other factors which we get from the ultrasound, like an NT value, which is called a nuchal translucency value, or nasal bone visualization, or in some cases we also talk about what is the LMP or the EDD, which is as per the ultrasound findings, or the CRL, which is called the crown rump length, or the baby's height basically. And then we find out a risk factor. So it's kind of an algorithm which gives you a risk involving all these factors, and accordingly we are able to generate a report which gives you an at risk. And these anomalies are like Down syndrome, which is trisomy 21, Edwards syndrome, this is trisomy 18, and also ONTD, which is like a open neural tube defects. So at Oncquest we have two platforms to assess this maternal risk markers. One is called Prisca, which is basically from an instrument from Siemens, and the second platform we have is Auto Delfia platform, which is an FMF certified, which is a Fetal Medicine Forum group certified platform. Also, this test is much more sophisticated. It gives you a much more better understanding and much more better risk calculation. Third but not least, it also is giving us a probability or indication for preeclampsia. Preeclampsia is also a condition which can cause early abruption in pregnancy, or it can cause a miscarriage in pregnancy. So miscarriages which can be detected early on so that you can take some corrective actions are very important. And preeclampsia itself is a condition which is highly prevalent in Indian mothers as such. So we do have a marker specifically for this, which gives you a preeclampsia risk factor also. Or the mechanism for the Auto Delfia platform is called time resolved fluorescence, because it captures fluorescence over an elapsed period of time rather than in a single point of time. So it gives you a much more definitive result, and it also gives you a result which can be reproduced for a prolonged period of time. These profiles are actually divided into the trimesters, first trimesters markers and the second trimester markers. We advocate more so on the first trimester part is for early detection. If you are able to detect the congenital anomaly early on into the pregnancy, we can take a more affirmative action as opposed to doing it in second trimester or later in the pregnancy, where it gets difficult to take some action. Second part is that the first trimester in Auto Delfia platform, which is FMF certified platform, we also have an additional hormone, which is the PLGF hormone, which is the placental derived growth factor hormone, which gives you an indication about the tendency for having preeclampsia. So that's an additional marker you get in the first trimester, and you get an early indication as if the patient might develop an eclamptic condition, which is a life-threatening condition for the patient later on in the pregnancy. So now just let's take a look at the result interpretation. If you look at this report, you will find out that there are multiple entries, multiple data which is being collected from the patient, and all this data starting from the age of the patient and the expected date of delivery, the last menstrual period, the crown lump length, whether the patients are twins, whether it's dichorionic or monochorionic, diabetic, whether the patient is smoking or non-smoking. So as you can see, all these things are considered into the algorithm, and these algorithms are then calculating the MOMs, which are multiples of mediums, and based on those medians and the deviation from those mediums, the algorithm looks at all these parameters and gives us a risk factor as to what is the risk of this particular congenital anomaly to occur. These charts would be colored charts, and the bar charts would show green or red depending on whether it is positive or it is in the safe area as such. The chart also gives you a very definitive answer in terms of whether there is a risk or there is no risk to the patient. So that will give you the next step to do in case there is an additional risk or there is a borderline risk. Normally would advise an NIPT in case of a very sensitive or very specific condition where there has been a history of congenital anomalies. Then probably you would go in for amniocentesis or a villus biopsy. So in short, maternal markers is a test to find out aneuploidies or congenital anomalies in an expectant mother. And this test, though earlier advocated for mothers of increasing age, now should be made mandatory for all expectant mothers, because Down syndromes can occur at any given point of time. Although yes, the age factor does come into play as other tests are done. So it is part of the antenatal checkup or makeup in few government's agendas and programs where they screen all the expectant mothers for maternal markers as such.